Movement for Mental Health, Blackboard seminars, number one. It says here, the body pharmacy. What I'm going to talk about here is something that the kind of thing that happens within the body when we exercise. A lot of people know, and perhaps you know this yourself, that when you exercise, you tend to feel a bit better once you've kind of got over the hump and done something, perhaps a workout, perhaps a run, something else, a yoga session. It doesn't really matter what it is. You notice that something changes. And this is certainly something that we notice every time, every day here in the Soma Space. People may come in and their states can change very, very quickly within the space of, a 45-minute workout. And what we have here is a number of things that happen in the body when we exercise. And we're going to go through them one by one. Some of these are hormones, some of them are neurotransmitters. Important for me to say that I'm not a biochemist, so this is a very, very simple explanation about what goes on in the body with these things when we exercise. Number one, I'm sure you've heard of this, serotonin. Serotonin is sort of thought of as the good mood hormone. It's floating around our system. A lot of serotonin is made and held in the guts. It's sort of flowing around the nervous system. Lots of it's in the brain as well. And one interesting thing about serotonin is that it is at its lowest first thing in the morning. But moving around helps it circulate around the system. So simply moving around first thing in the morning will help the serotonin to get going. So that's number one, serotonin, the good mood hormone. Second of these is endorphins. You've probably heard this phrase, the runner's high. People go running and they sort of come back from running and suddenly feel very euphoric. I'm a keen runner. And I've always really enjoyed running, and I've often found that when I go running, I come back and I love life and I feel slightly euphoric, and that's because endorphins are pumping around my systems. As I understand it, endorphins are kind of a pain reliever. Putting the body under stress means it experiences a bit more pain. Endorphins come in and perhaps numb that pain a little bit, but they also have this euphoric effect. So people talk about, as I said, the runner's high. What's happening there is endorphins, the rush of endorphins. One feels euphoric when one does exercise, particularly cardiovascular exercise. Another one of these is another thing I'm sure you've heard of, dopamine. Dopamine is associated with rewards. So when we do something, when we achieve something, we get something of a dopamine hit. And this is the thing that, as we know, can lead to doom scrolling, endless scrolling on social media, for example, looking for something, looking for a bit of a pleasure hit. This is to do with dopamine. One thing that we know and one thing that we see here at the Soma Space practically every day is people come in and they might do some boxing, they might do some lifting, all sorts of different things. And the feeling of having achieved something, they've pushed beyond themselves a little bit, they've gone beyond, they've managed to do, let's say, a heavy set or something, gives them a feeling of reward, which means that somewhere in the system, dopamine is at work. The last of these is something quite new, myokines. This is a relatively recent discovery. Myokines are molecules that are secreted into the bloodstream when we contract our muscles. So if I lift a kettlebell or do some dumbbells or a deadlift or something, my muscles are working and myokines become secreted into the bloodstream. And these things, myokines, have been termed the hope molecules because one of the effects they have is to produce a feeling of hope. If you're interested in finding out more about this, there's a fantastic article written by Professor Devi Sridhar. It's on the Guardian website. Take a look. She has promoted public knowledge about myokines. Really, really interesting thing. So in total, what we have here is a series of things that happen in the body, hormones, neurotransmitters, effects that are produced that produce also an effect on mood when we exercise. This happens very naturally. The body pharmacy gets to work when we exercise. So this is a little bit about what happens neurologically, neurochemically in the body when we exercise. Serotonin, the good mood hormone, endorphins, a feeling of euphoria, dopamine, a feeling of reward, and myokines, a feeling of hope. All of this is available through exercise.